record things and monitor the chat and also give you all the attention that I've prepared to give you. So actually, do I have any volunteers that would be interested in monitoring the chat for any questions? Oh, Alexa, I see that. Okay, so I'll try to do that also, but just in case, I don't want to lose track of anybody's questions. Okay. So I am going to get started. Thank you all for attending this presentation. To make sure that you're in the right place, I have it all right here in front of you. This presentation is anxiety yoga for stress management practice. And my name is Michaela Detrick. I am a student here at the Chicago School of Professional Psychology, and I'm a master's candidate in our clinical mental health online program. As of next week, I should be all finished up with everything, which is very exciting. I'm also, it's been about 2.5 years, I'm a Pennsylvania certified addictions counselor. I work kind of weekends as needed as a counselor in inpatient detox, and I've been doing that for about 5 years. I'm currently in field work through Chicago School. I intern in college counseling with undergrad, and I also facilitate outpatient trauma yoga with another therapist in our community. I accepted a new position this month as a part-time mobile therapist and BSc with a private practice in our area. So I will be working with children, a little out of my scopes as far as lately, but I'm very excited for that. But I've been able to develop a lot of passion with a lot of the ACE questionnaires coming out, and trauma, addictions, and creative therapies overall. Not mentioned, I have been a practicing yogi for about 10 years and not completely dedicated. I took some breaks within my pregnancies, but that's been a big part of my field work lately. And I have been able to co-facilitate chair yoga that we do an inpatient detox and do that with our detox clients, which is actually a pretty good adaptation. So I geared this presentation towards college counseling, mainly because of my field work and my recent experiences. I started my practicum through Chicago School in summer 2018, and I co-facilitated trauma yoga groups in outpatient. So these are very small, screened, selective groups. We didn't conduct any group disclosures about past trauma experiences within the group. Each of the clients did attend individual counseling. But within the group, we didn't have any disclosures like that, but we were all able to work together to develop connection, attachment, with feeling and emotion, being able to find relief, and really exercise our minds and our physical bodies. And each of these groups that we did, they started with a check-in. We did breathing, we did basic flows and stretches, guided meditation and imagery, and then we ended with another check back in with everyone. So within the groups, I really connected with the clients, with the group overall, and honestly, just the boundless curiosity with connecting our emotions to our physical bodies. And a lot of the research coming out has kind of nuanced that for us in the field. So I continued co-facilitating and leading these groups in outpatient, but I really wanted to branch out and be able to bring these tools with me to some of the other areas that I worked in, so especially to my college students here on campus. And what students can relate to the most is anxiety and stress. So anxiety is the #1 most prevalent mental health issue affecting young adults. And looking at a college campus, we can simply just look at this environment that students are immersed in and young adults are immersed in. We see their course loads, social encounters, adjusting to maybe being away from home, and all of the expectations with academic performance. So here at my field work, my supervisor and I, we decided to conduct open group events during midterms and finals just to see what the response would be. And we liked using yoga because yoga is very accessible. It incorporates physical movement, breathing, meditation, mindfulness, and it really eases and quiets a busy mind. It also actually helps to alleviate physical pain, which is a common comorbidity among young adults with anxiety. So in using mindfulness, individuals can learn to focus on the present feelings, their thoughts, sensations, rather than having to review the past or worry about the future. And students have a lot of academic resources on hand, like within a campus or within a school program. So anything that presents as mental health, students tend to be referred to counseling services. And we all know the stigma of seeing a counselor, the treatment barriers encountered with our clients who are given mental health recommendations. So we decided on campus to make an open group and advertise it as a yoga event for test anxiety. We just felt that that would reach a much broader audience. So most of what I'm going to present relates to this specific group that I developed. However, I really do want to encourage each of you to see how you can apply it to whatever setting that you are going to be in. If it's outpatient, if you're going to be doing a group, or even actually with individual clients. This is coming up a lot more, especially in my community. We're seeing these services offered more. So why yoga is a big question, and I wanted to give some of you an opportunity to maybe share, those of you who practice or you know about yoga, what are some things that you like and appreciate about this practice?
Hi, everyone. My biggest and most important thing about yoga is the mind-body connection that it provides.
Absolutely. Anyone else have anything they'd like to share? So you can think for yourself and just kind of see what you relate to. But just as was mentioned, the mind-body connection, yoga is such a great tool to help with that connection. And that's honestly, I guess, the least hippie way that I know how to put that. It can be a very spiritual practice, as that's how it was based. And yoga is a tool. It's not a treatment necessarily, but the word yoga means to yoke or unite. So it's bringing your body and your mind in sync with one another. Another one is mental practice, as well as physical practice and physical movement. And this is so much more than just fitness, although it's really great for me during pregnancy when I wasn't able to do a lot of extraneous work. But it works to align your mind the same way that physical activity works our muscles. So yoga incorporates incredible discipline of mental practice and mental flexibility and strength. And then mindfulness. So our goal is to really calm our mental functions and be able to find a focus. Our minds really tend to wander, and we think in either past tense or future tense, typically, while our bodies are obviously very here in the present. And that's why we see so many inspirational and motivational quotes to remind us about our present, like carpe diem, smell the roses. We really use this to practice bringing our mind back to where we are now, just to align with our bodies.
And Michaela, Susie said she uses yoga for stress relief or body detox.
Yes, and we'll probably hit on some of those later on too in the slides. It's definitely such a great relief. So in addressing anxiety, because anxiety takes on so many physical, emotional, and psychological characteristics, we can address coping strategies to manage anxiety. And we can do that through breathing, which is pranayama, postures or flow, which is the asana, and then meditation, which is the dhyana, which there are 8 different limbs in the tree of yoga, but I specifically want to address these 3 because I think they're so foundational. And the breathing is such a foundational tool that many of us actually use without fully acknowledging how to properly apply the effectiveness. We lower our heart rate, we can resume our focus, and we can calm our stress responses just through our breath. With postures and stretches and poses, the physical movements and poses in yoga are used to release toxic energy in pockets of our body where stress is held. So we can specifically address our hips, our shoulders, our back, our face, especially our foreheads and jaws, with different openers and relaxation, kind of like Susie actually had just mentioned. And then for meditation, guided imagery especially is tailored to the specific group population. So for instance, with our college population, I was able to use guided imagery for stress and anxiety, specifically to ease test anxiety. So I'll give you an example of that when I go more into guided imagery. But these, like I said, these are 3 limbs out of like the 8 that are, explained in yoga. And these are so basic, we use them in one way or another. So we can explore these and how to apply them in coping with anxiety. And these foundations really help us to build strength, flexibility, and most importantly, they help us to improve our concentration and even willpower. So breathing is, well, I keep saying foundational tool. All of these, I was trying to keep things as basic as possible because I'm sure all of you have seen either videos or pictures of people doing handstands on the beach. And yoga can be so basic. It can be just so simple sometimes, as simple as breathing. And so when we're angry, we count to 10, we take deep breaths, and some of this is very implicit for us, but physically, when we're anxious, our breathing becomes very rapid and very shallow. So by learning to breathe deeply, slowly, purposefully, we can lower our blood pressure, allow more oxygen through blood flow to our brain, to our body, and resume focus to whatever we're trying to concentrate on. So some of you can think of a situation that's created some anxiety for you, and then pay attention to what happens to your body, or some of you can think right now of what happens to your body. This is something that we often process with our clients as counselors, like what was going on for you, identify some physical responses which have affected emotional responses and vice versa. So with college students, when you get called on to read, college students, when you get called on to read a paragraph in class, or you have to share your answer out loud or something. Some of us have had our heart rate just start to race and pound. Our cheeks might flush. We might get hot and sweaty. And breathing really regulates this stress response, and it helps our bodies and our minds both to calm down. Breathing is also an anchor. It helps us to ground, and there are some specific breathing that will do calming, it will do cleansing. There are some breathing patterns that you can use to energize, and some are used for grounding. So when you breathe deep, you breathe mindfully, your breath can actually calm your nervous system. So this is how mindfully we can address physical responses in our body. We reduce our stress levels by stimulating parasympathetic responses, which is like our resting response. And that's part of the central nervous system. So we can activate that instead of what we hear most about, which is sympathetic nervous system, which is our response to fight, flight, or freeze. And that's our increase of adrenaline. So yes, our nervous system, it's part of survival. It's very important. It serves a purpose. But it can produce a lot of toxic irregulation if we're not able to just calm ourselves down sometimes. So breathing in general is such a great beginner jump start to a yoga practice. And I have like a mini demonstration. This demonstration is calming breath, and it might seem silly to do it in front of other people, so you can always modify it if you find yourself in a group. But for calming breath, your nose is designed specifically for, well, not just specifically for breathing, but it is designed for breathing. Incoming air, we filter it, it's warmed, it's moistened all before it reaches our lungs. Alternate nostril breathing is breathing through one nostril at a time. And that's actually what our body normally does. And you can observe that throughout the day if you pay attention. But the main benefit of this breathing is very psychological, and it's been described as nature's own sedative because it has such a calming effect, and it brings your body and mind into a state of balance. So you can try this with me. All of our videos are off, so we don't get to laugh at each other for how this looks. But each of you can bring your right hand right in front of your face, So your hand and your wrist are central to your chin. Then place your middle finger and index finger in the center between your eyebrows. And then place your ring finger and little finger onto your left nostril and your thumb onto your right nostril. So you should be able to open and close each nostril. Breathe in through your right nostril while you're closing off your left, and then close off your right nostril while you breathe out of your left. And then we're going to switch it. So then you breathe in through your left nostril while closing off your right, then close your left nostril and breathe out of your right. And that's just one round of breath. And I actually read that pretty quickly because I wanted you to have all the directions. So you can keep doing that on your own, actually. But you can start by doing just a few rounds of that. And as you get used to that breath, you can gradually build up to more and more rounds. And then just notice how you feel afterwards, because once you get used to it, you can prolong the exhale for double the count of your inhale. That's what helps your parasympathetic nervous system to become engaged and active, and it helps to bring you into a deeper, more relaxed state. I have another one that I don't have mentioned in here, but this is one that I absolutely love sharing with clients because it's kind of on the fly. Like, here, that's how you do it. Give it a shot. And also, I think it's kind of trippy, honestly. And I've shared this with some peers in supervision, so they're probably, if they're attending, they're probably very tired of hearing how I go on about this. But what you do with this is a grounding breath, and I honestly use this often with clients. And what you do is we just inhale and exhale through the nose again, which seems like the most normal thing to do, especially around a group of people. But we inhale for 4 counts, we exhale for 4 counts. And then as you continue to do that, you don't count anymore necessarily. You just notice that the air you breathe in is cooler than the air that you breathe out. The slower that you breathe out, the warmer your breath becomes. So you can breathe at your own pace and then pay attention to this warmth. And it actually helps you to calm your breathing without worrying that you're counting too fast or too slow. It just becomes more intuitive. And you want your exhales to be as warm as possible, which actually kind of forces us to slow our breathing down so much. And that's one that you can just like throw at your clients on the way out the door if they need some grounding. It's something you can do without having to demonstrate it or explain it to them. It's just such natural, intuitive breathing. Stress is an emotional strain or tension resulting from adverse consequences. So we each have a stress threshold. There are things that happen that we can totally cope with, but when they start to pile up or they overwhelm us, that's when our stress becomes very toxic. So school related, you might be able to read 20 pages an evening for a class, but if you get a little bit behind, you struggle to catch up, or you have more assignments added to your workload, things pile up and they overcome our stress threshold, which is just the amount of stress that we can actually handle. Our bodies, they hold these pockets of energy and stress. And stress hormones, we have adrenaline and we have cortisol. And cortisol is secreted in your stomach. So when you feel overwhelmed or stressed, you actually can get an upset stomach, like nausea or a butterfly feeling. It causes your muscles to tense up, like your jaw where you would grind your teeth or your shoulders might pinch. Stress and anxiety, they are both very, very physical. So what we can do is start with a body scan. And each of you can practice this right now. Body scanning is very simple. You take a moment to basically scan your body. So try that now. You can tighten up some of your muscles, loosen up some muscles, wiggle around, and just ask yourself, where do you feel your stress? And where do you hold your stress? Does anybody have any insight for themselves as to where they typically in their bodies hold stress? I'm seeing shoulders, neck and jaw. neck, shoulders, all of the above. Yeah, the most common areas that we tend to hold stress are our shoulders, and that's why massages really just tackle those knots for us. We hold it in our shoulders, our face, our hips, and oh, Dr. Jones just put lower back. And actually, when our hips hold a lot of our stress, that's where we feel it is in our lower back. So some of you could probably relate to these more than others. And with yoga, we can try very simple openers and stretches. And those are for our hips and our back, shoulders, and especially our face. And we encourage clients that as we go through stretches, they should notice any discomfort or pain. So we're not physical therapists. I personally am not a certified yoga instructor, and not every counselor or therapist that offers yoga interventions or techniques is not necessarily a certified instructor. So our clients need to notice any discomfort or pain. We're not going to do anything intense, but we do want to just allow ourselves to sink into poses. And then if it hurts, we back off, because that's not going to be doing any good for us. Yoga, it's very important to emphasize that yoga is very observational and it's non-judgmental as a practice. So we observe what we can do and what we can't do, and we just let those thoughts kind of just float away. Like we observe, okay, this is too much for me, and that thought goes away. We don't, try to dissect it or understand what that means. I am obviously not going to demonstrate any of these for you right now. However, if you would like some insight, if any of you have yoga practice or would like to incorporate poses into groups or individuals, these are just some starting points of what I have used. And cats and cows are very basic with yoga. They regulate your breathing. They're really great stretches for across your upper back, for your shoulders. And cat and cow specifically are great for connecting your breath. So for these, and actually we use these in chair yoga with our detox clients inpatient. So you can do it right now where you are in a chair. And for a cow, that is your breathing in pose, and you just press your heart forward, you raise your chin, and when you breathe out for your cat, you just hollow out your stomach, round your back, drop your shoulders, and drop your neck. And that is your regular pattern of breathing. So every time you breathe in cow. Every time you breathe out cat. And they're really incredible stretches, because every time you breathe out, you just extend that stretch across your upper back. Another great one that I use is, this is like a mini flow that I use to introduce. We'll go through a mountain pose, a chair pose, and an eagle pose. And mountain especially is a pose that looks so simple. I tell people when they stand up, great job, you're doing yoga, because that's mountain pose. But mountain pose really engages your legs and your core, and it symbolizes empowerment. It also symbolizes courage. So this is something that we especially use with trauma yoga. But when you modify into chair pose and eagle pose, those are ones that bring balance, and eagle especially. Look how complicated and twisted up she is. But it stretches your shoulders like right across your upper back as well. They're great, great, great stretches. So these are basic poses just to give you an idea of what to start with. If you want to do some great hip openers, those are often seated or reclining poses. So you can do a staff pose, forward bends, pull knees to chest, some fire logs. Some of you might not know what these are, and that's okay, because honestly a simple Google search will bring up like exact images and how to do these. And always allow your clients to rest in between. You could do like a nice child's pose. So these poses just give back some control, and you give back some power with standing poses especially. They're very control based. And you can do flows with some planks or downward dog or warrior. What I'm actually going to do with each of you right now is a relaxation for our jaws, because I don't know about you guys, but that is especially where I tend to hold my stress. And what you just start out with is check in with your breathing. You can do simple breaths where you breathe in for 4 counts and out for 4 counts. You can try the grounding breath that we did where your breath gets warmer as you exhale. But what I want you to do is, as we do this, sit up tall wherever you are, or stand. If anybody's standing watching this, I would be impressed. But just notice your body is very tall as you inhale and how your body softens as you exhale. Relax the muscles in your face. I invite you to visualize a warm glow on the crown of your head, melting over your relaxed forehead. Drop your eyebrows. Drop your ears. Feel warmth on your cheeks, melting the tension. And unhinge your jaw. Drop and move from side to side. And let your tongue just rest on the bottom of your mouth. Let it just fall. That's one that we especially don't notice throughout our busy days. When things start to get stressful, we just clench our jaws so tightly. By just pulling your tongue, just peel it off the top of your mouth and let it rest on the bottom. It makes such a difference. Guided imagery is part of our meditation practice. It is such a great way also to just increase awareness and especially mental stamina. So you can find really great books or scripts online of guided imageries, or you can create your own script. And basically, to explain guided imagery, it is walking your clients through a story or a relaxation. And it's really important to be mindful of the language that is used in the scripts. Some of these can evoke some images for our clients that could be harmful. If a client has specific fears that you're addressing, that's one thing, because then you can be strategic in how you gradually expose them to that. You know, if they have a fear of heights or water or tight spaces, you can gradually do some exposure through guided imagery. But this is also why group screening is so important. And we can use imagery of, well, this is actually an example of one that I encountered in a group where the imagery that was used was sinking into the earth, which was supposed to be like feeling grounded, growing powerful roots. But this was actually very disruptive to a client in the group who had recently experienced a loss and was grieving. So it reminded her of like a burial. So it's very important to be mindful of that. And the therapist did not know that ahead of time, but it's very important to be mindful of the imagery that you're using with our clients. And that's why screening is important also, so we know what our clients can handle sometimes. Always invite your clients to do something rather than commanding, and that's part of just not forcing things. The whole point of yoga is providing ourselves with control, providing us with power, and just being able to visualize success is what promotes increased confidence, increased concentration, and actually a part of that is increased memory because of the strength and flexibility that we build with our mind. So relaxation can really improve our ability to learn, and it eliminates the anxiety that interferes with taking in new information. So we invite our clients to settle into a final resting pose if you've been doing flows or breathing before that, because typically you would use a guided imagery towards the end of a session. And for this, you just invite your clients to close their eyes, find a comfortable position. If you have been doing flows or stretches beforehand, that activates our muscles and we feel very warm. So then when we're laying still or sitting still, we tend to feel really like more so cold. So they can grab a coat or a blanket if they feel cold, and just encourage everyone, if you're doing a group, everyone just grab what you need now so that nothing is interrupted. It's very disruptive for someone to get up, go to the bathroom, you know, doing whatever. Sometimes with meditation, we really embrace our anxiety without trying to fight it or overcome it. So retraining our brain to acknowledge that normal life does not require a high red alert that activates our stress response. It's retraining that fight or flight to be able to relax and stay calm. And those are my references if anybody
Well, somebody did ask if they could get a copy of the PowerPoint.
I believe I am recording this, so I believe that it will be posted, I think, in the advising forum. But if not, I did not provide my email, but I can try to type that in the chat if anybody wants to email me, and I can send this to them. But I did want to leave this open for questions because some feedback that I had received earlier when developing this what seemed to be related to college counseling and to using yoga practice in our counseling.
Well, you used it in trauma, so how is it different between the two?
There are actually a lot of overlaps with trauma and anxiety yoga. When we did trauma yoga, we specifically addressed things that may be addressed in individual counseling, minus the disclosure parts of things or working through stories. So in trauma yoga, when someone has experienced trauma, there is a lot of breakdown in relationships and being able to connect to other people, especially attachment. So what we did in trauma yoga was really work to attach to, first of all, our feelings. Many people feel out of body, so it's connecting to our physical bodies again. Actually, Bessel van der Kolk, he writes in his book, The Body Keeps the Score, he writes about his work with veterans with post-traumatic stress disorder, and he would place an item in their hand and they wouldn't be able to tell him what it was. They could not tell apart a car key from a stress ball or a pen, and it was just that detachment from physical sensation. So part of this is bringing our mind, our emotions, our body back together to be one and experience as one, and also being able to connect within ourselves and then with other people. With anxiety, there's a lot of that mind-body connection as well, but not so much the attachment or relationship portion, I would say. Any other questions from
What
anyone?
about, oh, yeah, I was going to ask, what about substance abuse? How do you think would be a good way to incorporate it with like juveniles who suffer with substance abuse, or who struggle with substance?
My experience has mainly been using this with adults in detox, but I don't see how it could be necessarily unsimilar. In detox, a lot of that was the connection again, but it's more of a holistic approach to things. So the physical aspect of detox is exhausting, and just all of the symptoms that come with detox, like irritability is just, it's a detox symptom. It's not listed in the DSM or anything like that, but like when you're withdrawal, it's a big withdrawal symptom. So being able to regulate our emotions and being able to find balance, especially in detox, even if our clients don't have a mental health disorder, but they have substance use disorder, even without that comorbidity or co-occurring, they experience spikes in anxiety and in depression. So someone who doesn't deal with that on a normal basis and is going through these highs and lows and feels all over the place like a roller coaster, this is what we've used to help them stabilize emotionally, especially in detox where it's very intensified. But I could see it being used in like post-acute withdrawal, which comes up usually after like between 7 to 14 days after a detox. Individuals will go through a post-acute withdrawal. So that's something that I've used within detox. I surprisingly have had large attendance despite how sick a lot of people are physically. the lack of sleep that people experience in detox. So I think that if you can get past the group of guys who maybe don't want to sit around and, stretch it out, if you can get past that barrier, I've found a lot of engagement to be encouraging.
Holly put a question in the comments if you didn't see it.
Okay, I see. Holly says, as a grad student and counselor, what are some tips to incorporate a daily yoga practice into a busy schedule? I love all the benefits of yoga, but I've struggled to be consistent. Personally, I have also, and I was actually going to a studio for yoga in the evenings, and then everything just gets, all of you can relate to how busy our schedules become, or, things change and it needs rearranged. It maybe doesn't work anymore. So I was able to actually do yoga in these groups. We were able to do some intense practice. What I found that has worked for me is I have 2 young daughters. My oldest daughter is 2. So we got a little ABC yoga. We did yoga bugs, where they have like a ladybug, and this is the ladybug pose that you would do, or a grasshopper, and she actually sits down and does it with me. Or YouTube has so many free videos. You could buy some DVDs to use. As far as being busy and not being able to just sit down for 20 minutes, for a half an hour, maybe you don't have space in your living room or your bedroom. Yoga is so diverse in a sense, where there's so many different ways that you can do yoga. So it doesn't necessarily have to be a physical, handstands and planks and all this stuff. You can practice breathing. There are times where I've practiced breathing in my car, just driving back and forth from things. And you can use guided imagery before you go to sleep at night, or do some meditation when you wake up before you go to bed. A lot of students that I work with, actually with anxiety, and I say students because I'm in college counseling, so clients that I work with anxiety, they have trouble putting themselves to sleep or learning how to fall asleep without watching YouTube or watching, anything. I don't know what kids watch these days, whatever's on their screens. But using a guided imagery podcast, or through an Audible or something like that, just listening to something do a progressive relaxation for you, to put your body to sleep, to ease your mind, put your mind to sleep. There's so many different creative avenues to apply it. I'm sure there's a lot of apps out there that can be downloaded for breathing and guided imagery. My Fitbit has like a relax button, and for 2 minutes it just like pulsates, and you breathe in and then you breathe out, and I've like put myself to sleep with that. It's actually pretty amazing, everything that's out there. Okay, I see the chat from John. You mentioned wheelchair yoga. Could you expand on how it benefits clients with a disability, and how to engage in conversation with clients who recently are wheelchair bound? So just to clarify a little bit, I've done chair yoga, not necessarily for physical disabilities. When I say chair yoga, it's as opposed to standing, where you're just kind of like stretching all over the place. Chair yoga, you sit for that. We do that specifically in detox because of detox medications that our clients are on. Withdrawal from alcohol and benzodiazepines, clients can be very high risk for seizures, even if they don't have a seizure disorder. So the medications that they're on helps to stabilize that, but we still, for safety reasons, have clients sit in chairs. And there's a lot of physical help that goes along with yoga, just restoring blood flow and stretching muscles. It actually stretches things that you really didn't know that you had to even stretch in the first place. It gets to all those little tiny muscles. So with chair yoga, we did that just like as a modification. In the chat, I see from Alexa, yoga has worked for individuals with injuries or disabilities. Do you have insight you would like to share?
Of course, Michaela, you would put me on
Or
blast.
just throwing that out there, I wasn't sure.
No, but DDP yoga was created by an ex-wrestler. So, but it has been effective veterans who weren't able to walk before trying his yoga, and doing this work, and then being able to walk without crutches and stuff like that. So I usually refer the DDP yoga to my male clients or patients, or athletes and stuff like that, just because they, it's a man, and it's the stigma is not really there. So I thought that was a good one when you asked about.
Oh yeah, I love that so much. I feel like there's so much out there. It's just such a vast field, and there's so much more coming out with all the research. Holly asks, do you provide yoga mats for your clients, or do you find poses that don't require a mat? If you're doing chair yoga, you just have to have a chair, I guess, or something to sit on with space. And our agencies don't typically have budgets for things like this. So it can be difficult. And I would encourage, if you have a budget, you could get mats. Or what I do is I just have everyone bring a blanket or a towel, which is not necessarily ideal. But depending on the room that you're in, like my outpatient room is like carpeted. So a towel really isn't going to slide around on carpeting. But it does, like, the mat kind of represents like some personal space for people. So to do it without a mat, you might have some space issues just with making sure people, have their space. But you could really use anything. You could have blankets for everybody. I did on my flyer for anxiety yoga with the campus. I just said, bring your own blanket, and it worked pretty well with that. Any other questions? Well, I just wanted to thank everyone for attending my presentation. I was able to incorporate all of this information into a group module to use within the campus, so that's something that they can continue to use even after I've left my fieldwork site. But those of you that would like a copy of things, I believe it'll be posted in the advising forum. And if not, I'll provide my email in the chat afterwards, and you can email me for a copy as well. So thank you so much for your support, and thank you for attending. Holly, I see your question here that just popped up. I don't think I've encountered clients who specifically are totally adamant that they don't want to participate for religious reasons. If that does come up, like spirituality does come up a little bit, and so we just address just kind of like, you're more than welcome if you don't want to participate. Like in a group, you can kind of screen for that ahead of time and see what people's interest would be. So that way, if they're not interested, they don't come or they don't participate. But being able to just incorporate the physical, like movements, like the fitness aspect of things, or meditation is not always like the I guess, the spiritual part of like being one with the universe, or the light in me honors the light in you type thing. I do know this is like something that comes up in the Christian community a lot. Like, if this is so spiritual and it's such an Eastern practice, like, should I be a part of this, like, Christian wise? But when that comes up, people are able to kind of identify with their spiritual beliefs, whatever they are, and really finding a distinction between spirituality versus religion. And that's actually something that comes up a lot in substance use too, because of like 12-step models that can be spiritually based. But just finding that distinction that, you know, spirituality does not necessarily mean religion. You're not roped into these beliefs, but you can still, like, we still are very spiritual beings in the sense where like we can have this like mind-body connection. I hope that answers it a little bit. Okay, good. I don't have a SurveyMonkey link for the assessment, but I will see if Jennifer can send us a link. And I have all of your names down as far as participants, so I can send her attendance and make sure you all get credit.
I think most people logged off, didn't they? I forgot to log off.
I don't know, some people stay in because there's one right after this.
Oh,
We
okay.
share a room.